Blog Talk Radio.
Hello, folks. How you doing? It's Danny Tisdale, and you're listening to the Danny Tisdale Show, and it's so glad to be with you today as we fight the coronavirus and so many other things that are trying to knock on our door. And as usual, if you have any questions or want to make any comments, don't forget to hit us up at Harlem World Magazine, anywhere on your social media platforms, Instagram, Facebook, Twitter, you know them. Hit us up and let us know. And as we do at every show, we speak to leaders, legends, and trailblazers in the world of Harlem, the greatest community in the world. And today we have Miss C. Virginia Fields, and she was born in Birmingham, Alabama. And you know I wanted to get that out first because my family's from Athens, Alabama, so I want to give props and love to all the Alabama folks out there, and especially to Miss Fields. Let me finish my introduction here. In 2005, she was Democratic candidate for mayor of New York City, becoming the first African-American woman to seek that office. She served as a member of New York City Council for 8 years. She was appointed president and CEO of the National Black Leadership Commission on AIDS, Inc., NBLCA, in 2008. During her tenure, NBLCA has grown to include affiliate chapters in 11 cities, and they are nationwide and rolling. Ms. Fields was appointed to New York State AIDS Advisory Council by then Governor David Patterson. She was appointed to the United States Department of Health and Human Services Region 2 Health Equity Council. She is a member of the National Viral Hepatitis Roundtable Policy Committee and Public Justice Project Steering Committee. Ms. Fields was appointed by Governor Cuomo to New York State's Ending the AIDS Epidemic Task Force, which was direly needed. Ms. Fields served as president of the Borough of Manhattan in New York City and chief executive of 1.5 million residents for 8 years. And in 2005, she was a Democratic candidate for mayor of New York City, becoming the first, as I said earlier, to seek office. And we have Ms. Fields with us today. And how are you doing, Ms. Fields?
I'm really doing very good, Danny, and so pleased to join you and your audience, and thank you for asking. How are you doing also?
I'm doing fantastic. You know, I guess under the circumstances with the virus being as aggressive as it is, I am, blessed to be here with you, and for all those listening who are, in the same situation, quite an interesting time in which we live.
Yes, these are definitely unprecedented times, and I just encourage all of us to listen to the public health experts, follow the advice, because there is just so much that I think we still do not know, and seemingly every day something new is coming out. Now we're being told about the babies, the young children. When at first it was that they were immune. So let's just be, very mindful. Let's practice social distancing. Let's wash the hands. Let's stay out of large gatherings. All of the things until this can become, a better handle, because there is no vaccine, there is no cure. So let's just try to be as safe as we possibly can.
I'm Ms. Fields going to freestyle a little bit here because you come from Alabama. I have family from Alabama, but I'm come from those roots, and a lot of time it's the philosophy was be safe over being sorry, and I know with those humble beginnings, what or who inspired you to do the kind of work that you're doing and that you've been doing?
Well, it certainly had to start in my own home with my mother. My mother was such a leader in her own way as the head of our well, we didn't call it block association, the civic association, that led to my being very involved, going out, helping older people register to vote, because at that time, in Alabama and most parts of the South, people had to take these means tests, which had nothing to do with your ability to vote.
I remember that, yeah.
So, as a young teenager, I would go around and sit with them and go through the book until they felt they were ready to go down. And to watch them go down and vote, that was inspiring, and that always stuck with me. But my mother was very active in the school. She headed up an effort for our band to buy our first uniforms, and I was a member of the band playing an alto sax. And she was a leader in the church, the missionary society. So it started right there at home, and I would add that my father passed. I'm the youngest of five. My oldest two siblings have now passed, so there are three of us, but I'm the youngest of five, and our father passed when I was 12 years old. And so it was left up to our mother to continue with the younger three of us to make sure that education first. And my brother, who was the oldest, stepped in as a father figure. So that's where I got my inspiration as far as caring, concern, and getting involved and trying to make a difference. And, of course, it went on from there. I had excellent teachers in my schools, even though they were segregated schools. But I tell people all the time, those black teachers taught us because they knew what we would face. And my pastor, who's the late Reverend Fred Shuttlesworth, who was the leader of the Alabama Christian Movement for Human Rights that made it possible for Dr. King to come into Birmingham, was my minister, and he baptized me. So I had all of these people right in my own household, my community, my school, my church, and I would say that is how who inspired me first, and of course it moved on from there to other figures. To
other people, right? And because I always like to ask that question because some people say, one person can't make a difference. You do it on your own, and I've never felt that way, and I've always thought that, somebody has inspired you to do the kind of, work that you do, and obviously you've proved that. And but I guess. We take advantage of that foundation here in Harlem and on the East Coast. What made you want to come this way to the East Coast and on top of it, get involved in politics?
And of course, I'm often asked that question, especially to say to even go to the point of even running for mayor of New York City.
And running for mayor, excuse me.
After graduate school, where I graduated from Indiana University Graduate School of Social Work, I got married. And the person I married graduated the following year from business school and was brought here as a product manager for Bristol Myers. So got married. That is what brought me to New York City. And I've often been asked, would you have come to New York if you had? And I don't think I would. It was never top of my list to say, move to New York. I know. I was living in Washington, D.C. for a year after graduate school, had a sister and her husband there. I was very content, living there. But got married, and that's what brought me to New York.
Well, I am so glad that you got married, I guess. And you
got married to someone who was in New York.
Yeah, that's what it is. Well, and it's amazing how life is and life positions you in different ways. And, we kind of run with it and take advantage of those opportunities. But, I might know the answer to this question since you said that your mother inspired you to do the work that you're doing. But I always remember you, and I still remember you as having an incredible work ethic. And Is that something also that you got from your parents, or was that something that, it has always been in you, inside of you?
I think, again, it started there, that you, things that you get involved with, you work at it to make a difference. And I learned that very early as a teenager. Again, I marched with Dr. King when doing the civil rights movement in '63 as one of the foot soldiers. And I learned so much during that time, building on, again, the foundation that I had already mentioned, and my mother being a part of the civil rights movement there. So showing how you stayed involved, and obviously, as everyone knows the stories of the fire hose, of the jail, of the dogs, and all kinds of inhumane things, toward people of all ages, that we stuck with it, and we saw what happened. We saw civil rights legislation. We saw voting rights legislation. We saw policy changes that opened up the doors that had been closed to Black people. So working at things and staying involved, that's part of what I call that, work ethic. You don't start something and just quit because it may not turn out the way you want it right at that moment. So building on that foundation and so much more that I experienced led to, the work ethic, going to school, and when I was even in graduate school, I thought that my professors and even some of the heads of the department were very racist, and it was so clear, and it was like you were designed to not come through this, and even my classmates knew that my work was superior to theirs, but I got a B minus or a C, or they got a B or an A minus and didn't deserve it, but that work ethic caused me to stay with it. I knew that's what I wanted. So I think that has always been a part of it. And I think it carried over certainly when I moved to Harlem. We moved to Harlem in the early 80s. Among the first groups who bought a brownstone here. And I have to tell you, it was very difficult, as you know, during the time you could walk in one direction, you could see people, Black people, carrying briefcases. You could walk in the other direction, you're tripping over drug addicts. And so
I do remember that.
Right. And in the early 80s, absolutely, the deterioration. But what I saw very early was very interesting, Danny, because we had lived on the east side for a few years, and we didn't have to do anything. The garbage was picked up, the streets were cleaned, everything. You had shops and everything. Once we moved to Harlem, the garbage was not being picked up. We could not get a loan, despite the fact that our combined income certainly, qualify us for that.
Right.
And so all of that just energized me to do what I have always been doing my life, challenging, making a difference, making certain that, what we saw was going to be a part of what we would fight for. So we fought to get a loan because it was nothing but redlining. At that time, our councilman was Fred Samuel, and we went to him. He backed us, and then he appointed me to the community board. And from there, I started working my community, calling sanitation, pick up this garbage before 4 or 5 o'clock in the afternoon.
Like you're supposed to do it, right?
Absolutely, and working to try to get more of us to buy property. I think perhaps one of the biggest disappointments as I look at things I've done and things I've been involved with is that more of us did not buy property at a time when it was affordable.
Affordable, yes.
And we were in the position to redefine this community and not have it redefined by others.
Well said. And I want our listeners to know, and And just a note for you, Ms. Fields, is that we're already at the halfway point, and our listeners are listening to the Danny Tisdale Show on Harlem World Magazine Radio. Harlem World Magazine is an independently owned company, so please hit that orange patron button at the bottom and become a patron. And I wanted to ask you, Ms. Fields, and as I always do, I always have tons of questions that are not on the question sheet I sent you. But I'm curious, in the time that we live in right this moment, as we hear about someone who's passed, we hear about a brother who passed, and it seems that he was shot by two white gentlemen. And but in times like this, I say to myself, we've come such a long way, and we have such a long way to go. What are your feelings when you kind of hear what you hear and then look at where we have been and where we are?
Well, first of all, I would change the word gentlemen, because they are definitely not gentlemen. They are thugs.
Thank you.
They are, people who clearly have absolutely no sense of humanity for anyone else. I think it speaks to what I think all of us know, too. Yes, we've come a long way, but we still have so far to go. Racism is still with us, and I think it was the Dr. Derek Bell in his book Faces at the Bottom, where he said that racism is here and it will most likely always be with us, but it doesn't have to stop us. We recognize it. We don't try to pretend that we are now a colorblind society. We have not been, and I don't think we ever will be, even under this coronavirus. One of the things during this pandemic, I'm very hopeful, is that people will really look at where we are and what has been happening with this world, because this is a pandemic. This is global.
It's worldwide.
Now.
It's global. Right.
So how do we treat each other? How are we concerned about those who are the least among us? If not for God, there goes us. So I think I'm hopeful that we will look at issues of racism, and from the work that I'm doing now as the president and CEO of the National Black Leadership Commission on Health, the focus on African Americans having the greatest numbers of persons who have either contracted the disease or dying from it. Many want to act surprised. There are no surprises here, because we have known, and data and facts show us that African Americans are disproportionately impacted by diseases that serve as factors, that are known factors to create more complications related to COVID-19. That includes respiratory diseases, cardiovascular, diabetes, obesity, and mental health, stress. So all of those African Americans are disproportionately impacted, and what I'm hopeful coming out of all of this, and we are so very, very, saddened by the deaths, and most of us know someone, or family members, or colleagues, or someone who's been lost to this. But I'm hopeful the thing that we do as Black folks is keep the focus, the need to make changes in many areas, but in health. We must fight for health care for all, because when we look at the number of people now who are unemployed, their health insurance is tied to their employment.
Employment, right.
Now that they're no longer working, they've been told at the end of April or at the end of May, your health insurance will be, terminated. So for me, coming out of this, I'm hopeful that we're looking at change on many levels that must take place within ourselves. And as a woman of faith, I say with our relationships with God and that we are looking at ways in which we can be a part of making those changes. So one for me is in the area of fighting for health equity, helping to eliminate health disparities, and trying to keep that in the forefront of everybody's mind now that the whole world knows what we have always known for far too long.
And been experiencing, right.
I'm hopeful that will be one of the areas along, things that so many of us have to work on. The economy, so much.
Yeah, no, and I think you quite eloquently stated one of the questions I was going to ask you next, which is, I remember when I first moved to New York and in the 80s and how the AIDS epidemic ate up my friends working in the arts community and in all communities. But I'm still at times, shocked and amazed that here we are in 2020 and it's still with us. Is there a reason that it's still with us? I've heard some people say it's because of, we have little blue pills that are helping some people continue to, as they get older, have sex. Why is the AIDS virus continuing to be the kind of virus that it is, which is to continue to take people's lives?
And I think that's a very good question, and I think we can compare that in terms of what we're seeing now, the rush to come up with a vaccine. One of the reasons AIDS is still with us is because there is no vaccine.
No vaccine.
HIV/AIDS is preventable, but there is no cure. And so the question has to be, why is it that there are now some 37 years there is no vaccine, and there's a push to get a vaccine for coronavirus within a year or two? And so I think I cannot answer the question as to why it is still here other than to say there's no vaccine. And there have been lots of obviously, advancements with drugs, antiretroviral treatments that people who are living with AIDS can take, and that enables them to have a better quality of life as long as they stay on their medication. In addition to that, there is PrEP, pre-exposure prophylaxis, which is a pill that a person who is negative but may engage in sexual activities that perhaps could lead to becoming infected, taking that once a day prevents a person from becoming infected. So all around us, prevention on that side, taking the medication, antiretroviral treatment for those who are living with HIV/AIDS to help them have a better quality of life, but yet there is no cure. There is no vaccine. And there are many positions that we hear. One has to do with the money, that there's lots of money out there as long as there is no cure. Pharmaceuticals and others, as well as programs that are run to work with people who are living with HIV/AIDS, the health programs and so forth. All of this now is big money business.
Money.
I hope not to think that there's not a vaccine because of these issues, but the reality is
we don't want to think that.
But there's no vaccine.
Yes, and I don't want to think that there's no, like you said, there's no vaccine and it's a money issue. Yes, I hate to think that, but I think you're right on that.
Let me just say one other thing about that I want us to caution us about, and I know we only have a few more minutes, is that when we look at the beginning of the AIDS epidemic, and people thought, again, it was just the white gay men problem. If you're not white and you were not gay, you had no problems. Not true. That is what led to the development of the Black Leadership Commission on AIDS, which is what it was first called, and then it became national as our reach expanded. But blacks were ignored. And
I remember
the same thing we're seeing now, and that's why I say we've got to keep our eye on this health disparities that now everybody knows about. Blacks were ignored, yet were dying from record numbers. And then, all at once, maybe about 10 years or so ago, blacks are disproportionately impacted, yes. Because blacks were not paid attention to, especially black women. Black women have the highest rates of HIV among all women. These are heterosexual black women as a whole. And so we were all ignored as a population. Yeah. Right. Yeah, we were all ignored as a population. Right. So I'm suggesting let us not allow this moment with the focus on COVID-19 and the disproportionate impact that it has on blacks, African Americans, and the deaths within our own communities, and allow that to just be, a pass in the dark or flash in the dark. We can't afford that. And I'm calling up on all your listeners and all your supporters and all of us. We need to stay on this as we deal with all of the other issues around keeping ourselves, our families, our loved ones, and our communities safe and healthy.
You are right on point, as always, Ms. Fields. And we've got 2 minutes left, and I want to quickly ask you two questions. One, and I'm going to ask you both of them at the same. Matter of fact, I'm going to ask you this one first, so that we make sure we have that. How can our listeners stay in contact with the work that you're doing, donate to the work that you're doing? You have numbers or URL where they can stay in contact with you and donate to the work that you're doing?
Yes, our website, we can be found on www.nblca.org. nblca.org will take you to our website and give further information about everything you asked for. And we can certainly be found on Facebook, Instagram, Twitter. And so if you go to our webpage, it will give you a wealth of information, including we have a donate page, because we certainly always welcome and need contributions as a 501c3. And we're doing a lot of work this time through webinars, through outreach in the communities, giving out masks as well as safe sex kits, which is a part of the work that we do even within this time period. So we're continuing to do this and working across the country to help other nonprofits that are really struggling.
Fantastic. And we have a minute left, and it's definitely not enough time. But I wanted to ask you, and we've got really less than a minute, but for someone out there who wants to follow in your footsteps, Ms. Fields, what do you suggest that they do?
Get involved. Find something that you really care about, or even if you don't care about, but if it's an injustice that needs to be corrected, just get out there and get involved, and you can become a leader. Don't look for others to lead, because that may not be what they are interested in. Do it.
That is fantastic, and thank you so much for taking time out of your schedule and talking about the work that you do, the important work that you do and the work that you are doing. And I know that our listeners will support what you're doing, and I will continue to advocate that they do so. And thank you, Ms. Fields, for being on the show and all the work that you have been doing. And thank you again, and please be safe.
And thank you, and the same to you and your loved ones. Thank you.
Okay, bye-bye. And thank you, readers, for listening in, and listeners, readers, thank you. And, we'll be back soon. And always hit us up at harlemworldmagazine.com and share us, donate, and like us. Talk to you soon. Bye-bye.